that you don't, can't find the link in your email, it is only going to be in your OK State email. And if you can't find it in your, like up front in your OK State email inbox, look in your junk mail. And if you can't find it on your Canvas, if you're looking at it through the Canvas email or whatever, look at it in Outlook, like the Outlook system for OK State. Like, I know that sounds weird, but that's probably where it is if you can't find it. Otherwise, if you can't find it, don't contact me, contact IEP. There's the address on the assignment for this, and I'm going to send out probably an announcement later, but you know, I found all of that just this morning, like I'm sure you guys did. They sent all that out, and so I tried to make the assignment as quick as I could so you guys can start working on that. But yeah, anyways, it doesn't take very long. Just go through and basically you give ratings to different sections or aspects of the course, and then you can leave comments if you choose to. Do it however you want. I'm not going to tell you how to answer the evals, of course, but I am going to say this. If you have complaints about the course, like, you know, too much homework or tests were too hard or whatever or didn't use textbook or whatever it is that your complaint is, I kindly recommend that if you are going to go on and make a comment about it, please give a solution or suggestion or something. Don't just tell me didn't use textbook. Just say didn't use textbook. Maybe, you know, refer or study more often or something. I don't know how you want to use textbook, or we have to have a textbook though. I will say that. Like, I hope you guys are aware, like that's not an optional thing. So we have to have a textbook, but like if your option is not have a textbook, then please just leave the comment blank because it's not helpful. Like, I know it costs money and all that, but we're actually required to like give you a textbook. So it sucks, but because I can probably teach most of this stuff to you guys without a textbook. But yeah, if you didn't like the textbook, if you want a different textbook, if whatever, then say stuff like that. Please help me, because to me, those comments, I want to be clear, aren't going to be read by anybody but me. So if you want to make a comment, nobody else is going to read that. So it's for me, that stuff is. And it's not like I'm reading it as you guys are filling it in right now. You go typing in, I'm hating the lecture, the part where we have to do a presentation. It's fine if you don't like it, and I will read that, but I don't get those until after you guys are completely done with my course. You'll get your final grade. Every single person will be done in the final grade. All grades will be finalized completely, and then they send out your stuff. I don't have any names tied to it either. I don't see whose comment was whose. Nothing like that. It's not even in like order, like if I wanted to try to figure out whose was who. So unless in your comment you say, hi, you know, I am Rachel, and I say that I hate the textbook or whatever. If you write that in the comment, then I'm going to know who you are. But like, Rachel, I saw your grades. I can tell you did not use your textbook. So yeah, so I actually, reason I'm saying all this is just so you guys don't waste your time too much with like filling out what you think is bureaucratic, you know, bullshit. The numbers they look at data-wise, like, and it's not even that they look at my numbers so much as they look at like university-wide numbers sort of stuff comparatively. But I want your comments because I want to know how to improve the course for the next group. So that's why I'm saying, you know, if you guys are going to leave comments, please help me help the next people. That's important to me. It's how I keep everything getting better and better. I'm always trying to make it better. I want it to be easier, but also maintain learning about the material. So any suggestions are welcome, of course. But yeah, I just want you guys to know what's up with that. I'm sure you guys have heard about that all before, but I'm not sure that it's made clear that like, even though my supervisors could potentially read your comments, of course, it's like open to, you know, all of our supervisors and everything too. And they try to make it this big, like overhanging, like big old deal and all this. Not that it's not, but like, I promise you nobody else is going to read that except me. Okay. So I'm just write whatever you want, but yeah, because I want you guys to help me do better at this job. You want to complain about how I teach the course, or you want to complain about that, you can use that in the ratings part of it. Sure, rate it terribly. The comments, like nobody's going to really read that. And of course, if you guys just really hate something about the course, you can always just, you know, email Dr. Rhodes or talk to your advisors or something like that and be like, this is the worst. She had the most difficult course I've ever taken, and it should not be hard. I should be easy, and I should be able to show up and just get an A and whatever. And I appreciate it. But yeah, please, if you guys do have comments to help me improve the course, I really do mean that. help me help you help the next guy. So chapter 24, we're dealing with the genitourinary diseases, or most of them are STIs. Not all of them, but most of them are definitely STIs. I promise I did. Oh, there it goes. Okay. But first, let's talk about chapter 23. So most common infectious disease of human beings, dental caries, right? Tooth decay. Define dysentery, that's bloody diarrhea. What pathogen causes rice water stool? So the pathogen associated with that is Vibrio cholerae. Remember, that's a bacterium. Which types of hepatitis have vaccines available? Just A and B. C doesn't have a vaccine yet anyways. What type of pathogens are Opisthochus sinensis and Clonorchus sinensis? Those guys are the Chinese liver flukes, so they are helmets. Okay. Cool. All right. What? Okay, surprise, there's that whole thing. All right, so the urinary tract. To begin with this, because this is the genitourinary system, not just the genitals only. So we're going to start a little bit with the urinary system. Kidneys, we know that's going to be filtering out waste from the blood, leading that waste in liquid form through the ureters into the bladder where it collects, and then it will finally vacate the body through the urethra. Easy enough. That flushing action of the urine helps eliminate microbes. Desquamation means removal of cells, like just shedding cells, basically. Most bacteria adapted to adhere to cells of GI tract can't gain foothold because of the flushing. So they usually have to have something that helps them hang on better, which we're going to get to in a moment with E. coli, right? Because E. coli is not made for this. It's from the GI tract. It can't make it in the urinary tract. So we have that diffusely adherent special kind of E. coli that is going to be associated with the urinary tract infections. It also has acidic pH, lysozyme and lactoferrin, as well as secretory IgA, which is present in a lot of the mucosa. So getting into the genitals, I really don't need to go too much into the details of the genital structures here, but we are going to be talking about effects on the penis. We already talked about the urinate part of it. We'll talk a little bit about the prostate, and that, you know, male and female have penis. So I'm not really sure if that really applies directly to the males. But yeah, we'll talk a little bit about that. Some effects on the testis, epididymis, structures of the, you know, testicles in general, but whatever. So we have, in the females, we will be talking about their, you know, tract a little bit more in depth than we will in the males, just because the effects of vaginitis versus vaginosis versus pelvic inflammatory disease and all the stuff that can happen, salpingosis and all of these things that can be affecting the female reproductive tract and everything. So we have, you know, the vagina as the canal leading into through the cervix and into the uterus. And then flanking the uterus, we have the fallopian tubes leading to the ovaries that will, you know, deposit the eggs throughout the cycle. So that's basically the concept of that, in case we're not familiar with the structures. There it is. All right, the defenses for females, because the whole tract is going to vary throughout the lifetime, so will the defenses that come along with it. We do have a covering of mucus. You will have more or less of that mucus present depending on what part of your life you're in. Again, we have secretory IgA because it's mucosa. Low pH of vagina, that will start in adolescence. Once you start going through puberty, we have a lowering of the pH of vagina associated with lactobacillus bacteria, which are the prominent species of bacteria in the vaginal area. So that's going to be related to hormone changes. The biota of women in childbearing years prevents establishment and invasion of microbes that could harm the fetus, which is pretty impressive, actually, when you think about it. You are meant to have a certain kind of biome in your childbearing years to protect a potential child. So that's really interesting. Because female urethra is short, you are more likely to get UTI than males. However, males who are not circumcised are actually more likely to have certain kind of biome in the foreskin that is going to lead to inflammation that could make you more susceptible to certain STIs. That's the truth. That's just the biome. It has nothing to do with being clean or not. So, yeah, I mean, I'm sure that I just do want to dispel that myth. A lot of people think that like, oh, you know, just because you aren't circumcised, that doesn't mean that you're dirtier. And none of you is saying anything about dirty, but what I am saying is that you aren't necessarily dirtier. That has nothing to do with it. It might mean you have a different biome that can make you more susceptible to, especially STIs. So that's the truth. Just FYI. It's kind of like whenever people say you can't get a cold from the cold, you know, and when we said, well, yeah, but it does make you more susceptible to getting viruses. It helps the viruses stay in the air longer, so you're more, you know, I don't know. We understand where these things come from, at least now. So for males, we have Lactobacillus and Streptococcus in the biome, and it's going to shift when sexual activity begins. No surprise there. You're exposing one part of your body to somebody else's part of their body. Naturally, that's going to affect your biome. Men engaging in vaginal, anal, or oral can harbor bacteria that produce vaginosis in females. So what we're saying is, depending on who the male is engaging with, even what part of the body they may be engaging with in that person, then the next time that they have, you know, sexual exposure to a female vagina, they could carry that bacteria and cause that female to get a bacterial infection in the vagina, and that's vaginosis. Now, I want you to recognize that vaginosis is a different word than vaginitis. Okay, itis always means inflammation. So inflammation of the vagina is vaginitis. Vaginosis is only infection of the vagina. There's no inflammation. Okay, there is a difference there, and you'll probably get tested over in the exam. It's one of the things I like to bring up. So, just a terminology thing. With females, we get lactobacillus, lowering the pH of the vagina, usually associated with, you know, puberty and change in hormones and that sort of stuff. Anytime you're going through a menstrual cycle, even just going through the menstrual cycle, you know, roughly monthly, can cause a major shift in the biome. Every freaking time, that's just crazy to me to think about that it's going to be that often that you could be shifting your biome around, but it is true. We do see Candida albicans present in low levels, and that is a healthy thing. It's just like a lot of the rest of our biome. The stuff is normal as long as there's only a few of them, until things get, you know, kicked out of kilter. You take some antibiotics for XYZ thing, and now suddenly we have killed all the, you know, bacteria in the area, and Candida albicans, a fungus, can overgrow and cause a yeast infection. So, yeah. But once you get into menopause and you're postmenopausal, which, to be clear, menopause is just a statement that you have gone without a period for exactly 1 year. If you've made it to 1 year, that's the beginning of menopause. And then you're postmenopausal after that. So it's not like some big old phase that you go through. People act like it is. It's actually what they call perimenopause leading into that. Whenever you're getting low on eggs and not having as often of a cycle and all of that stuff, perimenopause. But yeah, you don't, it's just a lot of terminology too. But anyways, yeah, all that's going to change your hormones, and that's going to change all the biome and everything. All right, so let's get into some stuff, some terms. Cystitis, polynephritis, urethritis. All right. Urethritis is just infection of the urethra. Cystitis is a bladder infection. Pyelonephritis, this is infection of the kidneys. Nephri is referring to kidney there. Itis, inflammation. Pyelo is referring to, like, basically, it means like fire. So, but here we're talking about like fevers and stuff like that associated with this. But you have that whole inflammatory reaction as a result of inflammation from the infection. Pyelo, fire, and infection at the same time. But anyways, cystitis, you're going to have pain in the pubic area, urge to urinate, pain during urination is not uncommon. Burning is not uncommon. And even sometimes difficulty urinating if there's enough inflammation. Cloudy urine, blood in the urine. It leaves out what I feel like is a more like obvious symptom of cystitis, which is the smell. But yeah, it smells like rotten eggs. But and if you go to the doctor and you have a urinary tract infection and they have a pee in a cup, it is not uncommon to actually have it be reddish in color. So yeah. And then they'll usually you can send it to the lab, but 99% of the time, if you open up that cup and you smell the smell and there's a cloudiness, and there's red in there too, you're like, I mean, what are you gonna say? That's definitely gonna be a urinary tract infection, right? So once it spreads into the bladder versus pyelonephritis when it's in the kidneys, and you'll start with the bladder infection typically, and then it'll move into pain in the back. You'll start to develop a fever. Once it gets to that, you should be seeking medical attention as soon as you can. If it's getting to the point where you have a high fever and it's really starting to make you feel horrible, you should head to the ER. But if it is just starting to bother your back a little bit and you know that you had the bladder infection, you know it's probably up, then urgent care is probably fine. But just use your judgment there. But you can have permanent damage to the kidneys just from UTI if you don't get it treated, and you can die from UTI if that happens. So yeah, so definitely get treated. E. coli causes 80% of all UTIs. Comes from the E. coli from your own bottom, if you're a lady. And don't worry, men, we have one coming for you that's quite the same. So, but yes, so E. coli, Escherichia coli, this is going to be a diffusely adherent version of it that is more able to adhere to the walls in that area. But anyways, there is catheter-associated UTIs. Those are going to relate to E. coli, Streptococcus saprophyticus, and Enterococcus species, just related from stuff all over the body, or Klebsiella pneumoniae species. So it just depends. But really, most of the time, we're dealing with E. coli. All right. All right, leptospirosis, taking a little bit of a shift to the zoonotic type diseases. Typically now we have pets getting vaccinated for this. If you were somebody who's going to the veterinary medicine, you probably know that, or if you have a pet. Leptospirosis, lepto, this is a pathogen in blood and cerebrospinal fluid. You'll have fever, chills, headache, muscle aches, conjunctivitis, and vomiting in people. There's an immune phase as well. That can be a mild fever and headache, but you'll also be developing meningitis. So, I mean, that's worse, but like the other ones have more acute sort of symptoms in the leptospirosis phase, and the immune phase is more chronic, associated with that meningitis and Weil syndrome, which is kidney involvement, hepatic disease with jaundice, anemia, and neurological stuff. So that's quite the progression of things as it's hanging around a little bit longer and being reacted to by the body a little bit more differently. So yeah, this can cause long-term disability or even death if it isn't treated appropriately. This is caused by Leptospira interrogans. It is a spirochete, just like we saw with syphilis. So very characteristic cell shape here, very characteristic. You can shed this in the urine, and animals will shed this in their urine, and then that's how it is spread from animal to animal, but it's also how you could potentially get it as well. But yeah, we treat this the same exact way that we would be treating syphilis, pretty much, or we also can use ceftriaxone in severe cases. It's pretty similar to it in that way, in the shape and in the treatment. All right, schistosomiasis. We learned about this in the last chapter. We learned about it being involved in, we called them the blood flukes, and it was horrible and all this stuff. If it gets lodged in the bladder, it can actually block the bladder, can lead to chronic infection of the bladder. This is also where it says itchiness in the area where it enters the body. Well, this is that swimmer's itch. This was how you typically are exposed to it from swimming in wastewater associated with this. And now we're telling you that this can be, exiting the body via urination. So you could be swimming in just pee water that somebody else is swimming in. They have this, pee out this organism, and then it just swims into your skin, and you get swimmer's itch, and now you have schistosomiasis. This is usually associated with schistosoma hematobium, specifically, not the other ones, which was like japonicum and Masoni or whatever. But yeah, remember that these guys are going to coat themselves with antigen. Well, we'll say antigen, but with the molecules from within your own bloodstream, so that it puts itself to look like you, so that you don't attack it, basically. Pretty interesting how it does that, but treat with praziquantel. All right, moving on, vaginitis. So this is talking about the actual inflammation of the vagina, okay? Is there infection going on as well? Yes, so it's not just infection. Vaginosis is infection, and there will be illness and presentation of illness, but not inflammation. Okay, so specifically inflammation here. Two agents that you need to be concerned about. If I ask you what causes vaginitis, the two you need to be aware of: Candida albicans and Trichomonas. Okay. So here we have itching and burning and discharge usually associated with these. So Candida is a fungus. You can see this in a gram stain. I want to be clear about that. Just because a gram stain is used for bacteria doesn't mean you can't see a fungus in it. You can usually tell actually by the shape of the cells and their general bigger size that it is in fact, you know, a fungus. So that's a useful thing still. Will lead to curd-like colonies on the walls of the vagina. It's opportunistic due to the shift in the biome. And we'll treat this with azoles. Typically, miconazole is the one you can buy over the counter, like, well, what is it? Miconazole is, I can't remember what it's called. Admonistat, there you go, thank you. And that sort of medication. So trichomonas, this is an STI, okay? This one's a protozoa, so even weirder. With this protozoan infection, they have flagella and they swim around. And whenever I worked at Southwest, they'd bring preps from like the hookers, and we would look at them in the microscope to see if they had trich, because that's what we were testing for. And you could see it swimming around in the microscope. It was pretty crazy, but right. So then these in females, you'll see a white to green frothy discharge associated with this, but many of the time males will be asymptomatic. They actually almost never have symptoms for the most part, as long as they're healthy otherwise. So yeah, it is the most common non-viral sexually transmitted infection. Pretty interesting, super common. What else? Yeah, metronidazole is what we would treat this with. It's what we commonly treat protozoan infections with. All right, vaginosis, moving on. So this is BV. When I say vaginosis, I'm talking about bacterial vaginosis. BV is what people typically call it, but that means that bacterial vaginosis. This is infection in the vagina without inflammation of the vagina, but you can have inflammation of other areas in the body. So that's where it gets nice and interesting, because you can have pelvic inflammatory disease as a result of this. So we're talking about deeper infections, deeper in the pelvic region. Now, so here we have discharge, fishy odor, and itching. This is usually a result of reduction of the lactobacilli bacteria and overgrowth with other bacteria. That pelvic inflammatory disease can lead to infertility and even ectopic pregnancies because the inflammation prevents the eggs from traveling down the fallopian tube the way that they're supposed to. It is not sexually transmitted, but if you are sexually active, you're more likely to have a shift in your biome that can lead to the development of this or be exposed to other bacteria. But yeah, prostatitis, this is what I was talking about with the men that were having their own coming. So prostatitis is the inflammation of the prostate gland. This is almost always caused by bacteria from the GI tract. So, I mean, take it to mean whatever you want it to mean, but yes. So this can become chronic. This will also just still be caused by bacteria, not anything different, but we will have development of biofilms within the prostate. So once those bacteria form biofilms, it usually tends to verge on the chronic presentation of the disease. We'll have pain in the groin and the lower back, frequent urge to urinate, difficulty or impossible urination. Sometimes you cannot urinate to the point that we have to take the individual to the ER so that the bladder doesn't burst, and they'll have to have bladder drained mechanically. So either by a catheter, if that is possible, or by needle, like aspiration. So that's the thing. Yes.
So is that kind of like, I'm trying to like visualize, is that like what the dude from the Green Mile had?
Exactly. Yes. So, and this will be also, you'll see if there is, as progressive, if the person can continue. That's exactly what I think of every time that I teach this particular thing, is the Green Mile. If you guys haven't seen that movie, by the way, excellent movie, really good movie. So, got Tom Hanks in it, amongst others. So yeah, it's really good. And then painful ejaculation as well associated with this, not surprisingly, because the entire region is going to be inflamed. So if you can't pee, you can't get anything else out either. So we talked about gonorrhea already, but I do want to just mention briefly that it's going to include salpingitis, which is that inflammation of the fallopian tube, which means that you are going to be prone to ectopic pregnancy if you do have this. And then pelvic inflammatory disease, just like we were talking about with that, it was vaginosis, correct? Yes, it was. Yes, it was. Okay. So now you can see this becoming a trend. We're not vaginitis here, but we are having the pelvic inflammatory disease and worse, right? So interesting how that's just moving that inflammation deeper into these structures. But yeah, females will have mucopurulent or bloody vaginal discharge, painful urination. Many times males will be asymptomatic, but clearly that's not always the case. So, but yeah. we mentioned a little bit, that was with the babies, they can have a lot of these diseases that we're talking about, babies can become infected with if they're born to mothers who are having these diseases. Remember, this is the gonococcus. I don't know what else to say other than what was already said. So, all right, moving on to chlamydia. It is the most common reportable infectious disease in the United States. This is meaning that there are other sexually transmitted diseases that are reportable. There are other ones that you can get that are more common, but this one's the most common one that's going to be reportable. Okay. Signs and symptoms for males, you see discharge and painful urination. But females, really not going to be symptomatic most of the time. They're not going to have no symptoms most of the time, but if they do, they will have cervicitis. So the cervix itself becoming inflamed. Notice no vaginitis still. It's really only going to be in that one area, just FYI, it's that one section. Discharge, salpingitis. Salpingitis, by the way, that's fallopian tubes being inflamed. And then pelvic inflammatory disease, PID. We also have development of lymphogranuloma venereum, which is going to be the invasion of the lymphatic tissues in the nearby area by the chlamydia bacterium, leading to headache, fever, and muscle aches developing from the infection. That's not going to happen all the time, but that is something that can be seen associated with this. It is bacterial. This is chlamydia trachomatis. We've already learned about trachoma, the blindness that can be associated with chlamydia. Just the same organism. Just exposure in a different area of the body. What do I want to say? Oh, we often see this as co-infection with gonorrhea. It just tends to be that, I guess, people who run in the circle that gets gonorrhea tends to also run in the circle that gets chlamydia. So we see them going a lot. Not to mention that the inflammation that is associated with that one disease can make you more likely to have the other.
Is there a big difference between like the micro or how they look between the two of them?
Like the bacteria themselves?
Yeah.
Yeah, the with chlamydia, like as far as the symptoms or the actual bacteria?
Like the actual microbe.
The microbes themselves. What I understand is that chlamydia is, I believe it's not a true cocci, I don't think, but I think it is a coccobacillus. But this would be one of those ones that you'd probably have to result on, maybe not seeing necessarily in a microscope. What I know for sure you can say about gonorrhea is it tends to go in these pairs, those little pairs. So even like here, it looks like you're looking at little rods, but that's not what we're looking at, right? We're looking at the little butts. They're just, which looks like rods to you. So those diplococci, very characteristic of Neisseria species in general, so the whole genus. Neisseria gonorrhea versus Neisseria meningitidis. Both of them look very similar to one another. So that's one way you could pinpoint it out if you were able to get enough resolution in your microscope to get that close. Otherwise, you'd probably have to resort to PCR or immuno or biochemical methods like culturing methods and stuff like that. Good question. I don't know enough about them outside of that. But yeah, we see that the rate of chlamydia occurring in females is higher than what we see in males. I mean, I don't know how to interpret that data. I mean, you could easily say that I guess the males get around, right? I don't know. Spreading the love, I don't know. The likelihood probably of females contracting it could be higher though than if males were to contract it. So that could have to do with the mucous membrane exposure. That's to be realistic, but we already talked about syphilis, but the only thing that we didn't talk about with that, well, I don't know about the only thing, but one of the main things we didn't talk about in the talk was the Tuskegee study. Extremely important thing to be aware of just as humans, to be aware of what humans have done to other humans in the past, just like we should never forget things like the Holocaust and things similar to that. This is slavery, none of that, right? We should remember all of that so that we never make that mistake again. That's the importance of history here. This is the same sort of case. Tuskegee study of untreated syphilis in the Negro male is what it was titled. This was in the 30s, where they took men who didn't know how to read or write or anything like that, and who had syphilis, and they just said, hey, yeah, sign up for our study and we're going to give you treatment for your syphilis, but they just observed them, refused to treat them, prevented them from getting treatment, and let them die of the disease so they could observe the effects of the disease on the human body. So it's horrible, 40-year-long study, the Tuskegee study.
So up to the 70s.
I believe so, yeah. I mean, this is, I don't want to be this jerk, but it's the United States government. What do you want me to say? What do you want me to say? So yeah. I guess any government really wouldn't be surprised anymore to us now at our age, right? So yeah, so we already talked about a lot of this stuff, but I do want to point out just the biggies here. However, this word, man, chancer, chanker, it's not canker. I know that. I think it's chanker, but this is one of those words I don't know how to ask, depends on who you ask, but chancer probably is the easier one to say, but anyways, this is how it's spelled, this word, be able to recognize on the test. But yeah, this is a hard bump that forms whenever the bacteria gets into the skin. Okay, so that is the characteristic identifier of primary. Secondary syphilis, the characteristic definer, of course, like being sick and having sick, icky, but at the same time, hair loss, okay, but that rash on the palms and the feet, very characteristic of syphilis, secondary syphilis. It has this certain brownish color that it gives the skin of the rash too. So it doesn't look anything like smallpox or anything like that. It looks like syphilis specifically. So the hands, the soles of the feet, it can be all over the body if it spreads enough. And then the third level of syphilis, the tertiary, is where we get those gomas as well as neurosyphilis, where we were talking about the pupils that don't contract anymore. Blindness, of course, can result from that. And then dementia. So we did talk about the babies with congenital, but yeah. And the disfiguring. All right, we talked about that. Be using barriers. Okay. You're welcome that I don't have pictures of this because this is probably the worst one. Okay. Cankroid. This is caused by Haemophilus ducreyi. We've seen another Haemophilus influenzae. I wish I could keep it to that one, but no. Haemophilus ducreyi is going to form another one of those chancers. Okay, can't even know how to say that word, but anyways, it forms this, but it's gonna be a soft version of it, and it's gooey, and it's yuck, and it's weepy, and kind of an open sore kind of feel to it. Okay, but it's about a similar sort of size. This is mostly in the tropics and subtropics, and associated with sex workers and poor hygiene, as well as uncircumcised men being more likely to get the disease because of the irritation in the area already there. But yeah, it's really bad, and you're welcome for no pictures. Okay. Genital herpes, obviously sexually associated. We have talked about it a little bit in regards to like meningitis and stuff like that, but you also can get it in the genitals. Clearly, that's what people know it most of. If you were talking about like having a cold sore, if you're talking about having, all that, we all know, yeah, it's herpes, but it's not the same. It's the same virus. Congratulations, it's herpes. So you have it forever, and if you've only been exposed orally, then it hides out in those nerves that are associated orally, and we think of them as just cold sores. You can get it from kissing people or drinking after them and whatever, and that's easy enough. However, if you get it in the genital area, or if someone had a cold sore and then was exposed to a genital area that way, then that you can spread it easily. If you have herpes 1, you're not protected from herpes 2. If you have herpes 2, you're not protected from herpes 1. You can get genital herpes from either one. Herpes 1 tends to be more commonly associated with cold sores, just in general. It's just more likely to be seen here. So anyways, it's just a virus. I mean, it's not really that big of a deal. The only problem is because it hides out in your cells, it can hide out in your nerves, in the actual DNA, right? So the problem is that you can't really get rid of it once you have it. And that's when we say herpes is forever. I say it a little jokingly, but I do mean it quite literally. There is absolutely no cure. There are treatments for presentation of the sores related to herpes, which are quite painful. The vesicles that are associated with herpes, they're filled with clear fluid. They're intensely painful whenever there is an outbreak going on. We see it associated in the genitals, perineum, thigh, the buttocks, most commonly when we're talking about the genital versions of these. Whenever you have oral versions of it, you usually have just 1, maybe 2 sores come out. Anyway, sometimes it is associated with encephalitis or meningitis. We did mention about neonatal herpes simplex a little bit, but this is just going over that. 30% mortality rate if it's associated with the mouth, skin, or eyes. Typical areas where you would see herpes, right? If it does spread into the CNS, that is a 50 to 80% mortality rate of the baby. So this is why it is absolutely necessary to go ahead with C-section if somebody is presenting with a herpes outbreak in the genital region when they're trying to give vaginal birth. They are DNA viruses. They become latent. They become reactivated through any number of things. If you're stressed in any way, shape, or form, it can become reactivated. UV, mental stress, injury, menstruation, microbial infection in other areas of the body. It's transmitted through the secretions of the virus. So, but you can still technically become exposed to it even whenever there aren't vesicles present, just FYI. Sometimes there are still live virus being shed in the area. So we treat this with acyclovir to reduce the shedding and to reduce the lesions, but it doesn't cure it. It just prevents the lesions. All right, so you can actually have increase. So this is another thing that like, this was a new thing to me when I started teaching this class, even though I was a virologist, I didn't know much about herpes. But having herpes makes you more likely to have HPV related cervical cancer. So I don't know how many of you guys know this, but if you are sexually active, you've probably been exposed to HPV at some point. Most people get exposed to it and don't even know they don't have symptoms or anything like that. Just clear it, normal, whatever. But if you are somebody who also happens to be exposed to herpes with that, then you're more likely to progress into cervical cancer if you have herpes as well, which kind of makes sense since it's incorporating itself into your DNA and stuff like that. But yeah, so you can actually see the presentation of the herpes in pap smears as well. So interesting. But pap smears are for detecting HPV, human papillomaviruses. They're for warts, yes, warts anywhere on the body, including on the genitals. But more importantly, when we get to it in this area, we're talking about it in the form of cervical cancer, of course. So females, you can get wart growths on the vulva, in and around the vagina, and silent infections of the cervix. So here we're talking about the viruses there, but you don't see any actual physical presentation of it. That's the more common way to carry HPV, is to get exposed to it and just carry it silently in the cervix. Males can have warts on the penis and the scrotum, usually no presentation whatsoever at all for males. Most time men don't know that they carry HPV, other than if a female that they were engaging in sexually had warned them that she had HPV. Otherwise, most of the time men don't ever know that they have it. And what can you do about that? But yeah, you can have condyloma acuminata, which is like massive cauliflower-like branching masses of warts if you do get genital warts from HPV. But the strains that cause the warts are not the same as the strains that cause the cancer. Usually the cancer-causing ones are the ones that don't have warts. So, yeah, there's been a link between oral sexual activity and increased risk of throat cancer associated with HPV. We're not just talking about cervical cancer here. This virus can cause cancer anywhere in the body, pretty much. And it's been shown that it can potentially do so. Anal cancer, oral cancer, cervical cancer, all sorts of cancers. So this is, they are DNA viruses. They incorporate themselves into your DNA, which is what is messing up the cell cycle and causing the cancer. So transmission and epidemiology, 25 to 46% of women under 25. I am not talking about over 25, right? I'm talking about under 25. 25 to 46% of women are infected with HPV. Under 25. So as we get to people who are arguing maybe against Gardasil vaccine, saying my kid is not going to be, 13, getting a sexual transmission, viral vaccine. My kid doesn't do that stuff. He's 13. Right. Hell yes, they do. Right. So like, we're like, nobody has to answer the question, but like, what age were you when you lost your virginity? What age were you when you started experimenting with this? And I'm not talking about it has to be actual true, like, penis and vagina penetration. I'm talking about oral sex, and stuff like, or anal or any of that. It doesn't matter, but like any sort of person to person contact. Yeah. How old do you have to be for that? I don't know. So anyways, so that's the argument typically, it's too dangerous of a vaccine for people to want to give to their children. I don't know if there's any danger really anymore than any other vaccine, but that is the issue. Yes.
Okay. So like women get like pap smears and like screenings all the time for like crap? Why don't men? Is it just kind of one of those things?
I don't, you know, it's
Or
a
is
good
it-
question. You can, I know you can't, men are far less at danger for developing cancer from it, and it is considered an invasive procedure because you are actually removing cells from the cervix. And I also think you can get tested for HPV from like, brushing of the urethra of the penis, sticking an actual brush into the hole of the penis. And, which like, I know for a fact, this is one of those moments, right? Where us women are like, yeah, right, yes, that's right. Where we're like, yes, we are aware of the discomfort that we endure.
They think basically it's bleeding in your cervix, like.
It's not, it hurts, right? Like, this is not a comfortable thing. It genuinely hurts. Or like, we could go into that whole argument too. This, I
was
feel
just
like,
wondering if there was.
no, you're fair, you're fair. No, they can. It's a voluntary thing that I think you would have to go ask to be done, but it's not done routinely. I think it's just because it's done as part of the whole well woman exam, and there's a lot more going on with the female reproductive tract than there is with the male. And the risk of cancer being higher in women than it is in men. I think that's really what it is. They want to be sure, because we have almost completely eliminated cervical cancer in the United States because of pap smears alone. But that's what pap smears are for, in case anybody didn't know. That's 100% only for HPV. Like, it tests for other things, you can see other things, but that is like the reason that they need to be done. And it has helped like almost completely get rid of HPV related anyways, cervical cancer in the United States, where in other countries it's still quite a serious issue. But it's a good question, but it does bring back to that thought, the disparity between the sexes of like, if you go to get an IUD, has anybody heard about IUDs? Like how? So I have an IUD. I'm on my second one. And knowing after having gone through the first one, you guys, if you don't know, man, I have heard, and I don't know, it's not the same for everybody, of course, but I've heard from multiple women that it is worse than childbirth without drugs. Like the pain, like it's a moment. It's not like a whole long drawn out hours of it, but it is like at least a couple minutes of enduring that pain all at once. And if you've had it done once and it's coming the second time was the hardest for me because I knew they were gonna have to take it out and put a new one in. And it's just like, that was the worst pain. And it is screaming. And I was lucky enough, I have my gynecologist is a male, but he's a very understanding, he's very good at his job and everything like that. But he's also one of those people like, I don't know why we're not allowed to give anesthetic. And if you ask, like, it's not practice. You don't give anesthetic for that. Why? But that's the truth, right? Like, why? There's no reason. There's no medical reason not to, especially at least like a numbing of the cervix or something like that. It's just not done. It's not practiced. But yeah, that's what I'm talking about with like the, disparity of the sexes, because men would never be asked to endure that. And I'm not kidding. And if you guys think I'm kidding, you can read up on it. It's men, but
I had the cancer scare, I had to do the biopsy saying after the pap smear.
yeah, me too. With the colposcopy and
Well,
yeah.
I had to have a BNC done and I've given birth,
Mhm.
but recovery, I felt like maybe because my gynecologist was female, she's like, oh, you got it, or my recovery was horrible because it's not natural.
Right, yeah.
They have to open you back up and go back in there, and I was like,
Oh my
they
gosh,
put me
yeah,
down,
horrible.
obviously, but when I woke up, it was.
You just expected to tough it out.
Yeah.
That's how it is anyways,
Yeah.
we could go on about this. We all know as females, this isn't really so much preached. There's actually like studies on this sort of stuff, but it's luckily people are looking at it. And I think that's a good thing. So at least there's that. It's a start. All right, there's also molluscum contagiosum. This basically looks like warts. It's not warts, but it's from a different kind of virus related to pox viruses. It's worse in people with immune issues. So like down here, this in the bottom right, that is contagium, molluscum contagiosum. On the left over here is the anal region of clearly a man with warts. Anyways, not to forget about something. This is something that seems so common and so tame. We talk about all of these streptococci that are all over us all the time. 40% of the people in here have some form of strep. Group B, just carry it on in our body, whether it's strep pyogenes, like we talk about with strep throat, or it is strep pneumoniae, like we talked about with pneumonia and everything like that, right? There's other kinds of strep, like streptococcus, staphylococcus, and all sorts of stuff, sabrinus, associated with all sorts of things in your body, right? So 10 to 40% of women in the US are colonized normal, not anything weird or strange or bad or anything, but just some kind of this group B strep. Nothing crazy. But however, when you are pregnant and you're having birth, the baby can become exposed to what is normal to you, the strep bacteria, and become colonized with it and develop things like meningitis and pneumonia and septicemia from just normal bacteria from you. So what they'll do is wait at 35 to 37 weeks, pretty close to when you're about to give birth, treat you with doses of penicillin and or ampicillin or other medication if you're allergic to those, to try to wipe out that colonization on your body, your natural biome, so you can give birth safely and not expose the child. They will test you for this. Is a very common thing to test for when you are pregnant, and they'll treat you again right before that, give you a shot of antibiotics. But yeah, if they don't, then you risk your baby's life. And that was looked like he was dancing. All right, anyways, chapter question was, why is HSV infection so dangerous to the infant during birth? And of course, we were talking about the effects of meningitis and all that. So this would be the picture. And if it's okay with you guys, if you want to do, for those of you who want to do the lab review, and you don't have to stay if you don't want to, because that's completely optional. I just want to say, I'm not going to take it personally, but I say that if you want to do the lab review, let's just do it in here.
Oh, yeah.
Because I don't think anybody is using this room. I'm gonna go to the bathroom, guys. I'll be right back. So just want to get situated and I'll come back and look at this.
No, I mean.
Oh, yeah. I looked in my emails.
Why would I do
Like your school. I went to my.
Hey, there's a real. I never think it's because you're on the online lab yesterday.
On the online lab.
I sat down here at 8 PM and I said,
He sent all the pictures into my every single one. To inside every single page.
was I in it?
Yes.
So where?
Yes. On God. We sent all the answers. I don't think you did. They're like, literally Kate sent half and then I sent the other half.
Well, you know what? At least I have my academic.
Wait, hold on.
It dropped me less than a point. I'm like, I don't care. I'm done. I was tired.
Guys, the semester's doing me in.
I feel that. I was gonna do it while I was working in the ER. People in the ER were stupid this weekend.
Oh, shit. Do you know how fun that is? That's what we really like on tour. Oh my God, yeah. Yeah.
Yeah.
I don't want to. He creeps up on you all the time.
Okay.
I know about.
I came up to you.
I feel like the meaner we are, the more things around us go. I'm sure she.
No, my boyfriend was yelling at me over this whole situation. I'm afraid.
I literally wanted to choke out your boyfriend for many reasons, this being one of them.
I'm like, I was gentle when he would come up here if I really wanted him to.
Shut up, Christian, but here's the thing. We're gonna retract back to that. We're gonna revisit the whole thing, because Carl was catching me.
Charles must have my hands too.
Bro, these actors are full real, only being 4 months. My husband had married with,
for years, and he has never once raised his voice at me.
No, he hasn't raised his voice at me.
We've been together for 5.5, maybe 6 years, and no, we've known each other since.
Oh, I'm getting a lot less subtle with my friggin', so much I picked out a pair of earrings that I like, and I said, I really like this stone.
My
And then
best
I-
friend.
And then I
loves
turned
it.
them and I said, if you want me to buy one, but I'm pretty poor idiot. Buy it for $45. Let's
For
be
real?
Let's be real about who I am as a person. I will lose it. I will break
My
my
best friend got engaged when her fiance or she fiance and I had been like thinking about ways to propose. And I've never been this excited about getting engaged. I am like being involved in this trip.
I guarantee you, I will get proposed to at like.
Oh.
No,
Hey.
definitely.
Oh, you gotta get her in.
Those, like, are-
I thought you were gonna go to the bathroom when I turned around. I think there's.
Oh.
I won't go. I didn't want to go there. I don't want to look up.
No, I looked at our total and I really like this thing, because I was just gonna get flash. Just went straight into it and I door closed and I was really walking to the beach. So, and my landlord texted me, I'm here. He said he was gonna
Let me separate these.
I'm literally like on my way to the.
It's so fun.